Thank you, Mr. Speaker. I have a clarification for the Minister for Finance. I would like to know how long does the government expect the increase in structural expenditure in healthcare to last, and at what speed it would increase? I understand that the increase is largely because of due to aging population. And the biggest aging generation is my generation, the medical generation. And I would expect that we will diminish in number over time. So how much is exactly the projection and expenditure?
Well, Mr. Speaker, I thank Mr. Lau for your questions. And I'm glad that you are in the medical generation. And as I said in my speech, I hope that our medical generation will redefine aging and that you continue to stay healthy, stay active, and stay connected, and live longer. So, so as to your question, how long will this structural increase in our healthcare expenditure last? Well, in my speech, I mentioned what we have been doing. For instance, studying what the OECD's experience. I've mentioned about the experience of a number of countries. Last year, I was in Japan to look at what they were doing to deal with the problems of an aging population. And I must say that there are many variables that go into the long-term care costs and the long-term support that is needed. In fact, the one minister that I spent a lot of time with is Minister Gan Kim Yong, because each time I see him, he comes up with a higher set of figures. So if you ask me how long will this last, I would not want to mislead this House that we are continuing to study this very carefully. All I can say it is going to last for quite a number of years. Yeah. And as I said, there are many variables which are not certain. Because, for instance, how will our lifespan change? And what is the extent to which our seniors will continue to be healthy? How will medical advances change? Right? And how would new drugs, new treatment methods change the cost structure and change the life expectancy? There are many doctors in this House, and I think even if you ask all our doctors here, they will not be able to give you a definitive answer because there is a wide range of uncertainty. So we must plan on a long-term basis. And we're not just having an aging population, we're also having aging infrastructure, as Ms. Ting Pei Ling reminded us. And as I said in my budget speech, we're also looking at all these long-term needs very carefully, and we'll share this when ready.